When I was a visiting nurse in Detroit about 50 years ago, in the 60s, I would ask my low-income maternal patients in their homes, as I went from house to house in the poor neighborhoods of the city, to get their children vaccinated, or to get prenatal care, or get birth control if they needed it. But often I found that they didn't do it. And so then I began asking, well, what would make it easier for you to do these things that I know and you know you want to do for your family? So what would help? And they almost always said, I don't have any place to keep my children. I don't have transportation. I don't have money. So then I began to think, what could I do to help solve these problems? And of course, over time and with the help of these mothers, we began the Mom and Tots Neighborhood Center in that neighborhood. And we had those mothers whom I trained as staff, as well as other nurses and doctors and others, to run a full-time daycare center, a maternity clinic, a birth control program, clubs for the kids, a transportation service, and many other things. And that was good, and their health improved, but that's not enough. It didn't solve the problem, the basic problem of their incomes, their bad housing, their lack of jobs, their lack of education. Actually, access to health care, as important as it is, and as necessary as it is, especially for minority populations, disadvantaged populations, is not enough, because it has not improved their health to the same level as their advantaged and white counterparts. And that is because health, equality in health, cannot be achieved due to the inequalities in income and wealth that have existed for decades and are growing wider in these recent years. And so eventually, when I left Mom and Tots, I continued the quest at a policy level for several decades to try to deal with the issues of a broader conception of health that had to do with not only health care, but food and nutrition, the income disparities, and other aspects that are elemental to a basic level of health that most of us just assume are there. And we should bear in mind that our advantage, our university education, our public education, is paid for by low-income people. It's their taxes as well as ours that provide this privilege of education that has moved many of us into comfortable ranks. And now that I'm retired and have the freedom to set my own schedule, which I couldn't quite do when I was being paid to work. I have had the joy to work on projects that have to do with these same problems, both at the policy level and in the local community, that have to do with education of kids from preschool to university, and from for affordable housing, for family assistance, for support to single mothers, women who have domestic violence problems, for prisoners. And I hope to continue to do that and carry that pursuit as long as I can. I think these are problems that from time to time get into the press, but they have never been strong enough to really make a fundamental difference. And I think that these are problems that all of us need to recognize and that all of us can help bring to the forefront, no matter where we are, whether we're in the arts, in the social arena, or the political arena. We have a voice that is in my mind, one of the greatest treasures of this country, a voice to speak out and to keep the message in the forefront. And so, as I go on, I hope, and I have the privilege of working with others who believe as I do, and I think this is a pursuit that's worth a lifetime commitment.